name is Russ VanderWilde. I'm a fellowship-trained orthopedic surgeon at Northwest Orthopaedic Specialists. I specialize in orthopedic sports medicine. I have special training to care for sports injuries and arthritis, including arthroscopic procedures. In this video, I'll be discussing arthroscopic rotator cuff repair. The rotator cuff is a set of 4 tendons that connect muscles of the scapula to the humerus bone. They provide both power and stability to the shoulder joint. When one of these tendons is torn, that tendon no longer fully attaches to the bone. Rotator cuff tears can either be partial or complete tears. In partial tears, the tendon is not completely detached and still has some healing potential in most cases. A full tear is a complete detachment of the rotator cuff tissue from the bone, and it has very little healing potential. It also has high risk to increase in size over time. A rotator cuff tear occurs when one of the tendons pulls away from the bone. It can occur in conjunction with an injury because of the degeneration within the tendon. An injury to the rotator cuff can happen when you fall or attempt to lift something heavy. A rotator cuff tear can also occur in conjunction with other injuries, including dislocation or fracture. A degenerative tear occurs with repetitive stress due to lack of blood supply, bone spurs, or weakening of the tendon over time. Patients over age 40 are at the greatest risk for a rotator cuff tear simply because of wear and tear. The most common symptom of a rotator cuff tear is pain and weakness. Night pain or cracking sensations can also be common symptoms. Treatment for a rotator cuff tear is specific to each patient and can vary significantly. Conservative treatments include physical therapy to strengthen the surrounding muscles, use of anti-inflammatory medications, and sometimes even injections. These options can provide significant pain relief for some patients. Arthroscopic surgery is a great option for the repair of the rotator cuff because it's minimally invasive, performed through small incisions, and there's no resulting detachment of any of your muscles. This is possible because the arthroscopic instruments and scope itself are very small. This results in a lower risk of problems like infection or stiffness. The repair, however, still requires healing of the tendon to the bone, and although rotator cuff repair procedure is very straightforward and easy, as well as low risk, the recovery from a rotator cuff repair is very long and difficult. Following arthroscopic rotator cuff repair, you'll keep your shoulder in a sling for 8 weeks. Our job's to fix the tendon to the bone, but you have to wait for that tendon to heal, which full healing requires 8 weeks. The day after surgery, we'll start range of motion exercises. After your first post-operative visit, we'll start formal physical therapy. Most patients resume normal activities 3 months following a rotator cuff repair. We consider full recovery and return to sports is typically 6 months after the procedure, with most patients still improving their strength and range of motion for up to 1 year. For further information, please feel free to go to our website. Thank you for choosing Northwest Orthopaedic Specialists for your care.